Recording.
Hello, Assalamu alaikum. Welcome to all of you to our course, PrepXperts. Okay, so basically, today's lecture is just an introductory lecture about the MRCOG for like all the basic knowledge you must be having. Why are you going for MRCOG? What is the significance of going for MRCOG and how you can go for MRCOG? Okay, so all the process of like exam booking, like how to you have to prepare the exam, we'll be discussing in today's class. Okay, if you have any query, any question, you can ask me at the end. Okay. Okay, so let's begin. So today we are just going like why you should go for MRCOG, how you are going to apply, and your preparation, and also we are going to discuss about the course details in which you are enrolled. Okay. Okay, so basically MRCOG, you all know that it is a membership of, basically it is a Royal College exams. So Royal College of Statisticians and Gynecologists, it is internationally recognized exam, you know, it's a prestigious degree. You can go by having completed all the three parts of MRCOG, you can go for having GMC or IMC registration, you can opt both. Okay. So this is actually a good pathway instead of the PLAB. Both are actually for your, if you want to go to UK or Ireland, you know that you have to have the registration, the GMC registration you need to have. And their specialist pathway. Because you know that after completing all these RCOG exams, you can enter into their specialist pathway. And according to your competency, they can adjust you. Like maybe they opt you for ST3 or ST4. Usually ST4 is actually the criteria that they can enroll you by completing all these MRCOG 3 parts. They can enroll you in their ST4 training pathway. Okay. So this is a better opportunity than the PLAB exam if you want to go to UK, or even if you stay here, you know that if you go for these Royal College exams, you have better knowledge, better understanding, because you are going to follow all the guidelines which they are going to follow in their setup. So it is a very good exam. Okay. So basically this MRCOG, actually it is for the obstetricians and gynecologists. This is not, you can say that this is a basic exam, because lab is just a basic. Like you go for FCPS Part 1, you know that you need to have all the basic knowledge, and even more kind of in the lab mainly with more clinical medicine is more. But RCOG, MRCOG exam is everything will be related to your gynae and obs. So those who want to pursue their career in gynae and obs, they have the better opportunity to go for this MRCOG exam. Okay. So currently we have three parts: part 1, 2, 3, and fortunately all the three parts are now conducting in Pakistan. So this is a very good opportunity to have all these three exams. So one is just your basic exam, like all your basics, which would be like if you have done the FCPS Part 1 or any kind of lab, MLE, you know that all your basic knowledge is tested in all these parts. So all your anatomy, your physiology, everything will be tested in this Part 1. So anatomy, physiology, your biochemistry, these kind of everything. And everything will be related to obstetric and gynecology. When you will be studying all these modules, you will be knowing that we have to understand everything which is actually linked to our gynae and obs. So that is important thing. Okay, just a second. So part 2, okay. So after completing the part 1, you can go directly to the part 2. You don't need any kind of experience. And I'll be discussing in the next slide that what is actually your eligibility criteria. So actually you all must be knowing that only the MBBS degree is required. So even if you are going for from part 1 to part 2, you don't need any kind of experience. If you have cleared part 1 now, you can immediately, the next attempt, you can immediately go for part 2 exam. So there is no set criteria that this much duration you must be having between part 1 and part 2. Anybody's able to join, please? Just a second. I think there's problem with few candidates. Mm, Okay, so they can listen to recording as well, if there is any problem from their side. Okay, so I was telling that from part 1 to part 2, you can immediately go to the next step. So there is no like gap. You can immediately go for part 2. Part 2 would be more clinical oriented. Like more clinical is about all of your obs and gynae, and it means all your obstetric and gynae guidelines would be studying in this part 2. So part 2 would be a little bit, you can say that a little bit difficult. So for that, you must be having a good amount of knowledge in obstetric and gynecology. So for that, we usually recommend that if you are going for part 2, you must be having a little bit of know-how about obs and gynae. So previously they actually set a criteria that from part 1 to part 2, you should be having 4 years of experience in obstetric and gynecology. So then you can say that, okay, for part 2, you have a good knowledge of even clinical knowledge, and then you can read all those guidelines. But now they have actually omitted that criteria. Now the experience has shifted in this pathway. Now you have to have experience of 4 years from going through part 2 to part 3. So, but still I would recommend that if you have a little experience about obstetric and gynecology, then only you should be opting the MRCOG part 2 pathway. So that would be a little bit easier for you to understand all those guidelines. So this is the second step. The third step is your MRCOG part 3, and now it is currently, or now it is also doing in Pakistan. So for 3, you need to have experience. So this experience is important, and you have many of you have the confusion that what kind of this experience is they actually approved. So basically, they have given you an AOT form, which is actually online, and this is your assessment of training. Training does not mean that should be your FCPS or MSMD training, but it can be a good if it is FCPS or MS training. But still, if you have any kind of 4 years experience in, like you are doing any private setup experience, any private, any government hospital, if you are, but this is mandatory that it should be, the experience should be in gynae and obs department. It's not that you are having experience in medicine department or surgery department, then that experience would be accepted. That is not. So you need to have a 4 years experience in gynae and obs. It should be under some consultant, which should be a gynae and obs consultant. Okay. Then your AOT would be. So this is a very good opportunity. Even if you don't get training, you just need to have experience. Either it's a private experience, you can go for this pathway. So this is a very good opportunity for all of you that you can, even if you don't have this FCPS or MS training, you can opt this pathway and you can have a very important degree by completing this part 3 exams. Okay. So this is about all the 3 exams. So part 2, you have both SBAs and EMQs that we'll be discussing when you go for part 2 pathway. Okay. So currently you are concerned with your part 1. This is your start of this Royal College pathway. So for that, you just need to have just this MBBS degree. So that is just required. So Even if you have not done the house job or you are going for house job, you are under the house job training, you can go for this MRCOG Part 1. But you should be having some PMDC number, and you know that this is provisional PMDC number is already issued when you start your house job. So just this number is required. They did not ask you for PMDC, but you can submit PMDC as well. So MBBS degree is required, and this degree should be in English. All your documents should be in English. This is very important requirement for you. Even if your ID card is not in English, you have to go for an English version of ID card. So this is mandatory for this Part 1 exam. Best time is whenever you go for any pathway, like if you have done lab or anything like FCPS 1 exam, you have a good knowledge of all your basics, then that is the best time that you can go for MRCOG Part 1 exam. Even if you are doing training or anything, you can go for this Part 1 exam. Okay. So this is the current fee structure. Like Pakistan and India both actually are in this band B, and we are in 572 pounds. Today rate is 382 pound. So it actually means that 2,18,000 is the current rate of this MRCOG Part 1. And plus, you know that the international transaction have about some taxes around like 10%, I think. So around 20 to 25,000 would be additional charges of your tax. So it actually goes till 2,50,000. And this is today's rate, so it may vary when you go for booking. So around 250 to 260, you can say that you must be having this much amount in your account for applying. And you can easily apply through your debit card. That is a very easy thing. And in India, they have just increased some rate to 675 pounds. That is about their Indian tax. Okay. Okay, so these dates are very important. You need to join. Why they are unable to connect? Just a second. Let me see this. No problem in the link. Link is working. Just I think we need to pause the class. I just want to resume. Okay, so this is a very important dates. Up till now, you must be giving your eligibility form submitted. You must be submitting your expression of interest form. Okay, so these two steps are very important. You must be, if you are planning to give MRCOG Part 1 January exam, you should be completing these steps. Step 1 is your account formation, step 2 eligibility, step 3 is your expression of interest form. And the deadlines means that before that, you need to submit your expression of interest. Before this date, 9 September, you need to submit your expression of interest form. Okay. So these three steps are very, very important for today. If you are planning to give January exam, you should be submitting all these two forms. So you must be doing it as early as possible. Okay. After that, you just start preparing. You have 2-3 months, and see the booking window opens on this date, Tuesday, 21st October 2025. This date is very important we'll be discussing later on as well. Before booking, I'll be having another class, how to book your exam. But let me tell you just one thing, that booking window usually closes, like all the seats usually fill within 1 hour. So this is that whenever this date arises, 21st October, you just need to say that you have to book your exam within 1 hour. Otherwise, all the seats will be occupied, or you may get a seat very far away, because they have Pearson View centers now. You cannot say that it is only in one city. Now they have multiple Pearson View centers in all the major cities like Lahore, Islamabad, Karachi, even Multan, Faisalabad. These kind of, I think, major cities, they do have these Pearson View centers. So you can go easy, whichever suit you easier, okay? So you need to fill your, go for your booking window, apply the, book your exam as soon as possible. This is very important. You cannot say that, see, the booking window closes on 9 September. You cannot say that, okay, I will see that if I have time, so much time, so I can see if my preparation goes well, then I can go for the exam. This is not correct. You have, if you want to go for exam, you have to book your exam as soon as possible. And let me tell you one thing, that whenever you book your exam, the maximum preparation then only starts. Before that, before booking, you just linger on your studying. So booking is very important. You should, if you're planning, you should book your exam as soon as possible, and then only your preparation would be going, like you, very harder your preparation is going, okay? So exam is on your 14th of January, and after 4 weeks, your result would be coming. Okay, please wait for us. Okay. Okay, so these dates are very, very important. I was telling you that you would have to do all these things. Okay, so this is how you need to apply. So first thing is your plan, that either you are going for MRCOG or not. So if you have planned that you want to go for MRCOG exam, then okay, first step, MRCOG account formation. You need to go for account, apply, make a RCOG account, then go for eligibility application, then go for expression of interest. Okay, so these 3 steps you need to complete till now. Then is the exam booking. The last step is exam booking, and that is on your 21st October. It is not now. So you have plenty of time before exam booking that you can at least cover the major portion of the syllabus before booking. Okay. So these are the 3 steps. I'll be telling you the full detail of how to book your exam. Not book, sorry, how to send the eligibility, how to make account. So this is all things you need to know. See, you need to go for this official website, which is rcog.org.uk. Account formation, RCOG number. That is very important. See, this is your RCOG website. Here is the register and sign in point. You need to go register. This is how you need to register. You need to enter all your title, name, last names. Very important point is that you need to write your name very correctly, like that name which is on your documents. See, it is not that you just change your second name like whatever you want. That is not. So you should be making account with your real name that is on all your documents. Email, you need to add your email address, and make sure that that email which you are using, and also which the password, you know that of that email. So if at any time you forget this login information, you can have the, like, forget password, and you can go for renew your RCOG account, because you cannot make RCOG account again and again. Okay. See, verification code would be sent to your email ID, and then you need to complete your whole account details. All these, see, all the address they take, the password, and then you need to log in with the RCOG account. So this is the first step. After you log in into your, you make an account, you log in. See, here would be your name, and below that would be a college number. Now this college number is very, very important. This number would be written on all your three exams, like part 1, part 2, and part 3. This is your correspondent number. So this is why I'm telling you that this account formation is very important thing. You need to enter the details very correctly. In that, actually, there is an option. You cannot say that you can change like address. You can update the address because after each exam, you can say that your address is changed. So you can update the address accordingly. So this is not that address would be remain same in that account. You can update these profile settings accordingly. But this number you must be, this is important number. It would be written on all of your 3 exams, okay? Okay. So the second step is your eligibility application. For eligibility application, very important point is that you have to submit the eligibility application only once. It means that if you have given eligibility like 2 years back when you planned to give MRCOG and you sent your eligibility application and it came back as approved, your eligibility is approved, then you are eligible for lifetime. So now you are not going to send eligibility application again. This is important thing to remember. So it should be submitted only once. If you are eligible at one time, you would be eligible for lifetime. Still, we have so many candidates who are unable to join. Okay, so this is important thing, and also that they usually take 4 to 6 weeks. You cannot say that you have sent the eligibility and it will when it will came back as approved. So it usually takes time 4 to 6 weeks, and even the approval process starts after the deadline ends. Okay, so you have to wait for eligibility, but usually it is approved. If there is any deficiency, they can send you back that, okay, this is not like correct, then you can update it later on as well. Okay. So this is how they have written. See, this is how you will go for this RCOG website. This is the home, the careers and training, the exams, your MRCOG, your part 1, and then how to apply or apply. So this is step by step, all the points that you go for. The second step is your eligibility application, and only for one time you need to submit the eligibility if you have previously either given exam or if you have previously approved your eligibility, you don't need to send approval again. Okay. So this is your eligibility form. You need to click on this, and now the form is all online. Okay. Previously, it was in the hard form, like it's a PDF form you need to download and fill up. Now it is everything is online. Expression of interest is the next step. Okay, so third step is expression of interest. I'll tell you that later on. Okay, so this is how your eligibility application, when you click on the eligibility application form, this is how it comes. See, the first point is GMC registered accounts, and the second is non-GMC registered accounts. And you know that we all are non-GMC. GMC registered accounts are only those who are working in UK. Otherwise, rest of all the candidates are non-GMC registered. Okay. So you need to go for this non-GMC registered, and here you need to have your RCOG account number, your medical registration number, which is your PMDC number. You scan copy of your government issued ID. So this is your national ID card. So that is should be in English. That is very important thing. Even your MBBS degree, that should be in your English. And also the names should be on your degree and the ID that should match. Okay. This is also very important. Don't write any different name. It should be correct, whatever the name is on your official documents. Scanned or photo of your medical degree certificate, or you can upload registration certificate. Registration is your PMDC and degree is your degree, like whatever MBBS degree issuing. So that is your MBBS and PMDC. So you can select any, like you can upload any document, either MBPS or PMDC. So the documents should be in English. These are all the requirements you must be knowing. It should be English, legible, original document. Take picture, scanned copy of original document. So that is important. And you may attest, but usually they do not ask you about attested documents. So if you want, you can go for attestation. Otherwise, it is not, attestation is not required, because already all your degrees are there's stamps of controller, exams, everything is on there. So you can take picture from original document, just that is required. And also the next is, okay, so this is the processing time. So here you need to click on the start application, and then you go for this application form. This is the whole of your eligibility application form. You need to fill everything very rightly. See, the first thing is your RCOG account number that they have already given you on your profile. Then see, you are non-GMC registered. This is important point. Then write your name, first name, last name. This should be same on your ID. So very important points. Email address. Now here email address should be same as you have used for your RCOG account. That is also very important. So you know that everyone have 2-3 email accounts. So whatever account you are using for your RCOG account formation, you have to add that email address here. Okay. So email address, then the gender, then the date of birth, then the name is same. You need to select yes. Then the ID card, you need to upload here ID card. Then the qualification. Okay. So medical registration number here is your PMDC number. Then is your qualification, like if it is MBBS or MBCHB, whatever you have your degree is. Then the university name, either it is, but which university, college name should be there, the country. So you need to write the country name. And then either you upload the degree or you can upload the PMDC. If you want to upload both, you can upload both, okay? So you can upload at one document at this point, one document at this point, okay? So this is how you can upload all these documents. Only basically 2-3 documents are required: your ID card, your degree, and PMDC. So these 3 documents are enough to apply for PMDC, and this is your eligibility application. And the rest is your ethnicity, nationality, your religion, they do ask, any disability, and then you just select your terms and conditions. And sometimes students do get confused by this signature form. So few mobiles do have an online signature that you can write your signature here, but you can write your name. They do not ask you that you just you have to write your signature. So you can write your name easily, okay? So then you need to just go for this submit option, and then it would be just send. You just would be like, after this submission, you will just be having a response that thank you for submitting your eligibility application. You will not be getting any email that, okay, yes, your eligibility application has been sent it to us. So you just wait. So just you need, you will be having a thank you response, and then that's enough. Okay. Just go for the third point, which is your expression of interest form. This is important thing, that expression of interest means that you need to express that, okay, I want to give this exam. I want to give this January 26th exam. Or even you say that, okay, no, I will go for July 26th. For July 26th, you need to give submission expression of interest almost in the next year, okay? After this deadline ends, then the July 26th expression of interest would be starting, okay? So even if you have given expression of interest before, then you need to submit it again and again. Whenever you want to give the exam, you need to submit expression of interest. So this is important thing, that it should be submitting again and again whenever you plan to give this exam. So this is important thing, that you have to send this. And a very important point is that before eligibility approval, like, you are first time candidates and your eligibility is not approved yet. So you just submit your eligibility application, then immediately after submitting, you go for expression of interest. You don't need to wait for your eligibility will be approved or not, then only you can go for your expression of interest. No, it is not. So you just go for eligibility application, and then immediately after that you go for expression of interest. So that is all you are required. So this is form, this is how they are, this is a very brief form. See, only these 4 points are written: your RCOG number, your name, your last name, your email ID. Just this much required, and you need to submit your expression of interest. So this is much knowledge is required for your expression of interest form. Okay, so after that, what is that? Okay, so this is how these are all the steps that how you are going to apply for RCOG exam. So for up till now, everyone who are going for exam, you need to have an RCOG account. Just I am summarizing what we have discussed today, that if you are going for MRCOG exam January 26, you need to have these 3 steps, very important 3 steps to be done today or tomorrow. That is very important. So first, go to RCOG website, make an RCOG account. You will get the RCOG college number. Then go to again this, see, this is the website MRCOG Part 1. And here would be the how to apply. Then the second step is your eligibility application. Okay, so you need to send your eligibility application. This is important thing, and this should be done only once. Like if you have sent your eligibility application 2 years back or whenever previously, then you don't need to send it again. So that is, it means that you are already approved. So then the third step is your expression of interest form, and that is compulsory for all candidates who want to give the next exam. So this should be repeated. Like if you want to give, if you have like given expression of interest previously in the last exam, now you have to give expression of interest again. If you want to give now in January exam, you need to submit expression of interest again. So these 3 steps are important steps. You need to complete these 3 steps till now, so that whenever the exam booking comes, before exam booking, you all will be receiving your eligibility approval. It usually takes 4 to 6 weeks time, and that time starts when the deadline ends. So you all would be eligible because only MBBS degree and government ID card is required, nothing else, but it should be, ID card should be in English, even your degree. The degrees are almost all are in English language, but ID card should be updated, okay? So must update your ID card. It should be in English. Okay, so these 3 steps, and then the 4th step is your exam booking. That would be on 21st October 2025. This is very important date, and you should book your exam as soon as possible because seats usually get filled in within 1 hour. Okay, so these were the 4 important steps of exam booking. Okay, so now what are your exam? What is about your exam? So your MRCOG Part 1 exam is all about the 2 papers, which is the whole 2 papers are your single best answers questions, okay? So 2 papers, paper 1 and paper 2, and both have 100 SPAs, okay? 100 SPA in paper 1, 100 in paper 2. So total 200 questions you would be having. Time duration is like 2.5 hours for both exams, and you have a 1 hour gap between both exams, okay? Both paper. Each paper would be having 50% marks, like both paper. It is not like you need to separately pass both paper. Overall, your percentile would be coming, and there is no negative marking, and there is no minimum percentage that which is the passing percentage. Basically, they are using the percentile criteria, which actually corresponds to the candidate's performance. Okay, so how good candidate performed in exam, then the percentile would go higher. If the overall candidates perform little poor, then the passing percentile goes a little down as well. This is the whole of your modules that we will be discussing in our class. All your basics, your anatomy, your embryology, physiology, almost 14 modules are in this part 1. Endocrinology, biostats, biochemistry, genetics, data interpretation, immunology, biophysics, pathology, microbiology, pharmacology, and clinical management. Okay. A rough estimation of questions, because you can say that more questions comes from anatomy. It is a huge portion of anatomy. Data interpretation means all your figure or points or numbers form are in the data interpretation. So usually the incidences and the values, the numbers, they usually come in exam as part 1. So that is also a major portion. But still, each module has actually around 8 to 10 questions minimum each module do have. So you cannot skip any module. You have to prepare all the modules equally, even very good. And even I'll tell you one thing, that you cannot say that see, anatomy have more questions, but still they might set the criteria that this question has less weightage, and some other module like genetics have one question about the mode of inheritance that might have more weightage in the exam. So might it be that this is a it has more weightage, more than 1 mark can be there on that question. And also they do say that in all these Royal College exams, they do say that you must be solving for easy questions. They do say that easy questions have more weightage. They can say that. So it means that, easy questions, they would be, every candidate would be easily solved. So if you just by mistake you attempt that question wrong, so that might affect your percentage. Okay. So you should not be wrongly attempting these easy questions. That is very important point. Okay. So all these modules basically are important. You cannot skip any module. This is just because this is about your RCOG. They can do anything about any question. Nobody knows that which question has more weightage. Okay. So just it is that they have set a criteria that this much questions are important for candidates to solve. So this is about their criteria. We do not know all the knowledge that this question has more weightage. Okay. So just the purpose is that you need to prepare your exam very correctly, very good, so that you might have no loophole in your preparation. Okay. And what I want to tell you about all these modules, one thing, like, that all your basic books, they are a little, I think, older books, older versions, they are not updated. And even that anatomy, embryology, they do not change. All these things, they are like the older ones, they are same. Data interpretation, because that numbers, the values, they do change. Like that the diabetes, the range, what is that, the OGTT values. So these numbers, they might change within recent guidelines. So they do follow the guidelines, RCOG. And these microbiology, all the infections, these are very important. They have so many guidelines on each infections, and they are usually updated recently as well. Every yearly they do update these guidelines. Okay. So, and also for the clinical management. So these 3 modules, they are very important. And for that, I would suggest you that whatever we will be discussing in our lectures, that would be more important for you, because that would be updated. I'll be telling you, I'll be mentioning as well in the class as well, that this is the updated one. You do not need to follow whatever it is written in your book. Okay. And also you have to see that, most of the MCQ books might be old. So you need to discuss that, okay, this one is not correct. So you need to correct those things as well. So about these 3 modules, you need to have a updated knowledge. Rest of all the things, you can say that you can read from books, you can follow all the books, because these do not change. Basics do not change, but these clinical knowledge do update every year. Okay, so these are the books that these 2 books are your basic books to read if you want to read. This is your explanatory book. It has all the explanations of all your modules. And this is just a revision notes, only in the notes form. Like if you have read the FCPS first aid, you must be knowing that all the bullet points, every point forms, this book is just your point form. So you can cram those important points, but after having a basic knowledge. So first you need to read this book. If you want to read, then you need to read this book. But if you follow or like my lectures, then I have taken most of the knowledge from this book, so that you don't need to go into detail of this book, but you need to follow this book, because there are so many points which we cannot add in our lecture. So this is your revision notebook. So you can add more points, and you can in this book, because it is your revision book. So these are just the two books which are required for exam. And we have so many MCQ books. And if I have shared the link in the group as well about the past MRCOG, it is a module wise MCQs. And this is actually your RCOG MCQ. So this is very important. Whenever you finish one module, you just go into the past MRCOG file. Okay. So that is important one. Then this Andrew Caesar is important, Catherine is important, BMJs. So this is actually your practice books. You need to practice these questions daily basis. After covering one module, if any book has the portion in module wise, you can go to that book and finish your module. But few books, they do not have the portion in the module wise, so you can after completing a little, like half of the syllabus, you can go through these MCQ books one by one. So this is just for your practice sessions, this MCQ book. And we'll be starting this course, and we'll be having like your, we have almost not 5 months, but we have around 6 months till exam. So we have plenty of time. We have taken like around 4.5 months. Will be taking your schedule slowly, so that you can take up your pace. And we'll be having 2 classes every week. Your recordings will be available after your class, almost in the next day. Your recordings will be available. All the lectures PDF will also be shared, so you can revise through those lectures. We'll be discussing all the recalls of 5 years only, okay? Because the previous one are more older. So the current 5 years, we'll be sharing all the recalls. We'll be discussing that in the last month as well. Okay, so this is how we'll be taking your course. That today is your introductory session, and for at least 4 weeks, actually, I have taken for anatomy. See, almost 4 weeks we have for anatomy, because anatomy is very important. Till 10th August. So anatomy is very important, and actually it is a little bit difficult. So I have expanded the anatomy portion to one more further week, so that anatomy should be on your fingertips. So this is very important. So anatomy, then embryology, physiology, all these modules will be covering. And I have added till 30th November, we'll be finishing our course. Then in the December, we'll be having all the recalls discussion, and then the mock test will be in the next 10 days. So this is how we have divided all our schedule a little bit easier for you if you are doing job, so that we'll be having less portion for daily, so that you can go for the read daily. So time is that if you say like 6 months are more than enough for MRCOG part 1. But if you are doing job and doing some house, like you have kids and all that, it means that you can only spare just 2 to 3 hours in start, or even less than 2 to 3 hours. Okay. So for that, then the 6 months are more than enough till that. Okay. So 2 to 3 hours, you need to save 2 to 3 hours at least daily to read these things, because anatomy is a little bit difficult. You have to go back to your MBBS part 1, MBBS first year, second year, and then you know that your anatomy is a little bit difficult. So you have to cram all those points, even anatomy, embryology, a little bit difficult, but rest of the topics are more clinical, so that you will be gripping quickly. But anatomy, embryology are more time taking, and you need to revise it again and again and again. Okay. So for that, anatomy is always top priority, that we have to cover anatomy at least first. Okay. So it should be on your fingertips. Okay, so this is all we have scheduled our course. So we'll be taking our classes, 2 classes a week, and days I'll be sharing with you in 1-2 days. So we'll be having a class. I'll be sharing on the WhatsApp group. Okay, and the time would be same, the 9 p.m. Pakistan time. And what else? And any question you want to ask, any query up till now? So anatomy, you know that we'll be starting anatomy from our next lecture. So for that, we need to have a basics of all your abdomen, your pelvis, perineum. So this is your anatomy, that you need to have all the anatomy of these portions. Okay. So we'll be starting this lectures. Okay. Okay, I'll tell you that when we are going to start our live classes, and I'll sharing you the mini schedule of anatomy in the WhatsApp group, so that you can start preparation. And I have shared the groups, the book link of your almost theory books and the MCQ books, and also the drive of link of Pass MRCOG in the WhatsApp group. So you go to that link, you can read out everything online. Okay. Lectures enough to cover our knowledge. We have read the Oxford Revision whole book. Yes, actually lectures are more than enough, but you need to read these Oxford Revision notes. I would actually recommend everyone to just read these Oxford Revision notes because they have few important points which I cannot add in my lectures, but these are important. So first, lectures, because you can have a good understanding about the topic. Then you can just read the topic which you have understand from the lectures. You can just go through the Oxford Revision notes. So that is all just enough. And the job is engaged, precise, compile. Yes, so that is why lectures would be all compiled and easier, so that you can listen to the recordings, you can go through the PDFs that will all be compiled. But still, I will recommend that Oxford Revision notes do just give a read. Otherwise, it is not very mandatory. I'm just telling you that, okay, you can go through that book. RCG guidelines, no, they are not required for part 1. RCG guidelines, all your GTG, they are required for part 2. But we will be covering few important guidelines, like important, I told you that infections are in this. So infections we have to cover from guidelines. So that I will be covering your modules, okay? Thank you so much. Thank you. Any more question? So basically your preparation would be from your notes, these lecture notes, and also your practice books that are very important. You need to practice your SPS that are important. So stuck on CNS, it's husband name, their father name on the degree. No, it is not, it would not be a problem. Husband name and father name, yes, it would be right. They do not require that husband name and father name should be there. Just your name should be, like, you should not change your name. Okay. That full name should be your same as on your degree, as on your ID card. Thank you so much. About ID card, that must have same name. ID card must have, yes, ID card, because your ID card should be like just I am Sana Amjad. So my ID card should be having this name Sana Amjad, and all my degrees should be having the name of Sana Amjad. Okay, so that is actually mandatory. You know, some people do change their second name after marriage. That is actually the problem. Because if you know that my name was on degrees Sana Amjad and now I change my name on ID card, that, then comes the problem. So that is why you need to have same name. Okay, yes, inshallah, we all pass through this exam. Kamal should be on both ID card and medical degree. Yes, and full name of Kamal. Like whatever your name is, second name, the last name, it should be same. That is mandatory, because you should not change your second name. Husband name, father name, uh, that is not a problem. Just 5-year records in PDF. Actually, we will be discussing just 5 years, but if you have any paper or you have any question, any query, you can share with me. We can discuss that as well. Actually, I have compiled few previous questions and I have compiled those questions in your mock test so that you can practice those questions. So that is why I have not added those previous recalls paper in this recall discussion. And also one thing that because if you take your 2015-16 paper, you know, the guidelines are usually updated. So those important points, your microbiology, data interpretation, clinical management, those guidelines change. So then the confusion arises with the options. So that option was correct at that time, but it is not correct now. So that is why I do not take those previous recalls. Big gap regarding what I will. No problem, no problem. If you have a big gap, like all of us do have gap. You know, after MBBS, we do not study at all. So don't take this that you cannot do it. You can do it, and it is a very doable exam. Just take this as a hope that you all can do it, and very easily you all can do it. This is a very doable exam. Okay, latest RCOG guideline link. Uh, Yes, I can share you the RCOG guideline link. This link is just, I think you can write on Google the GTG guidelines. Okay, then all your GTG guidelines would be coming. Okay, so those all the updated ones, they can come. But you do not need to cover all those guidelines, okay? Yes, I'll be sharing the topic as well. But I'm telling you that I'll be starting with anatomy and also the abdomen portion. So anterior abdominal wall, posterior abdominal wall. This is actually my topic, first topic of class. So I'll be starting. Just I'll be sharing with you all the detailed schedule of all the anatomy, how we are going to cover the anatomy. So again, I'm telling you that this is a very doable exam. So do opt this exam, even if you have a gap, because even those who do not have this much gap in study, you know that basics are a little bit difficult for us. Even when after house job you go for this exam, then also you do have some difficulty, because anatomy, embryology, they do you might have forgotten all those things. So you cannot say that you everything you are knowing, because these are not on your fingertips. Anatomy, embryology, you can easily forget. But still, this is a very easy exam. You can say that all of you can do it very easily. Okay. Okay. So don't go to the GTG guidelines. They are actually required for part 2. Okay. So only those points which I will be telling you in our class, that much is enough. Okay. Okay. Any question? Any question? Okay. So we'll be having like one module, we'll be covering one module, and then we can have some mock test as well. And one thing I'm going to add in this session, like I have not done in previous sessions, that whenever I cover one in class or one module, then I want one discussion class of all about the MCQs. And that would be like, I want your presence, so that we can discuss only those MCQs would be relating to that module. So that, and actually this thing I am going to add in this session. So I need active participation from all of you candidates so that we can discuss more and more questions. Okay, at least 2 to 3 hours. Starting 2 hours would be enough. I can say that 2 hours, because you know that whenever you start your anatomy, you are sitting and you start reading. You know that everything would be going above your head. You must take so much time to start your pace. So you take time. So it depends on you that how much time it takes to grab all those things. So that is actually, you can have 2 to 3 hours is enough. Enough. It means it is maximum 2 to 3 hours. You can minimum it should be at least you should read few points, few things daily. That is all which is required. So start from anatomy. I'm telling you, all of you, that I'll be covering your abdomen portion. So abdomen, anterior abdominal wall, posterior abdominal wall. You all should start reading, and then we will be discussing, and then we'll be having MCQs as well. So that it would not be only a teaching session, it would be a discussion session as well. So then you can have more and more confidence and more practice session along with the teaching session. So that would be more beneficial to you. Okay, thank you so much. Okay. So you will be, inshallah, you will be happy to join this course, and I want all of you to actively participate so that we can grow together, okay? Okay, so I think, yes, days I can specify. Actually, previously I was taking the Monday and Wednesday. So weekend I do not take. Um, so then actually I want that this week, see, today is Tuesday, so only tomorrow is Wednesday. So if you want, then I can take a small class tomorrow so that you can have a quick understanding. Then we can like shift to the next week. So actually previously I am taking Monday and Wednesday. And time duration is just 1 hour. I do not take class for more than 1 hour. 1 hour, 10 minutes or 5 minutes just go up, and just 1 hour. So that is why I take two classes, and it should be just 1 day gap. Okay, so I'll be sharing the days. If you have any specific days you want, then we can adjust. But actually, I do not take classes on weekends because, you know, weekends have so many plans. So I do take class on weekdays. So Monday, Wednesday, or we can take Tuesday, Thursday, or Monday, Thursday, any day we can specify. Okay. So I think in this week we can take class on Thursday. I think Thursday or Wednesday. Thursday. Okay, let's decide Thursday. Okay. So first class we can take Thursday, not Wednesday. Please, is my call on it. Okay. Thursday. Okay, if all of you say Thursday is fine, then we can, or we can shift the days as well. But actually, if the days is fixed, then I know that, okay, today's class, because I don't know about the date. Date I do forget. Only with day, Monday, Wednesdays are better. Now Wednesdays and Thursdays problem. Somebody have Wednesday. Okay, no problem. You can have all the recordings. So one day you can skip, you can read, you can listen to the recordings as well. See, now the somebody have Thursday on call, somebody have Wednesdays. Emergency call. Okay. So Monday, Wednesday. Monday, Wednesday. Actually, my days are also Monday and Wednesday. So it means we can take class from next week. So we can start our class. Okay, so let's take a little small introductory class with 3 days gap between two classes to cover that gap, to cover the topic. 3 days gap. Actually, why I do not have a gap? Because I read so many things because I teach you in a detailed lecture. Okay, so then I give you the time to cover all that lecture, and then you can go to, if you want to go to the book, then you can go to the book, and or you can solve few questions. So that is why I take 2 classes, just 1 day gap, so that you can have detailed topic which is covered, and then you have time to revise all the topics. So that is why I have taken this thing. Okay, we can, I think we should not fix the days. I do think, because somebody has Friday, Monday, Wednesday. Okay, so for that, I think I need to have a schedule, like which date we can have live class. So it would be like not feasible to all of you, because I know that all of you might be in the training, or so somebody have emergency duty, night duty, day duty, call. So then you should be have listening to the recordings. So that would only be the possibility, because it would not be suitable to everyone. Okay, so what I was telling that okay, so let's have a class on what is today's date? Let's have class on Monday. Skip these 2, 3, 4 days, so that you can go for abdomen. You just start your abdomen or anti-abdominal wall, post-abdominal wall. These 2 topics you will be covering. You have plenty of time, because 1, 2 days you take to submit your eligibility, expression of interest, and then you start studying this anatomy. And then we'll be discussing anatomy on Monday and Wednesday. Because this, when you have previously reading few things, then the discussion would be a little bit easier. So Monday, Wednesdays, we'll be having a first class on Monday, and we'll be covering your anatomy and your abdomen, anterior and posterior abdominal wall. Okay. Okay. So I think this would be correct, because you know that the days should be fixed, so that uh, we know that this is all class day, and the time would be fixed, so that we can schedule all things. Okay. Okay, so with this we have covered, I think, every point. So let's start studying now, and we'll be discussing our classes, taking on class on next week, Monday, and wish you all the best, and we'll be having a very good time together. Okay. Okay, so everybody, let's goodbye and Allah Hafiz. Thank you. Take care.